Hello students, today we will discuss a case of axillary nerve injury. So let's see, this is the picture of the patient. Let's see what patient has complained to the physician. So the 45-year-old man who is a chronic user of crutch went to his physician and complained that he had noticed a loss of the shoulder counter. You can see in this picture a loss of the shoulder counter on the right side from the last 2 months. There was no sensation in this region. I can say the right region, right shoulder region. When the physician examined the patient, he found that a patient could not abduct his arm up to the 90-degree. There was loss of skin sensation over the lower half of the deltoid muscle. Physician also noticed a prominence of the great tubercle of the humerus. After this examination, a physician diagnosed the patient. This is the case of axillary nerve injury. So what physician has observed, you can also observe in this picture. So this is the patient which has come to your clinic. So let's see. On this case, a question can be asked, what are the three causes of the axillary nerve injury? Mention the origin and the root value of the axillary nerve. Third one is write the cause of loss of skin sensation over the lower half of the deltoid. Then what is the cause of loss of shoulder counter and prominence of the greater tubercle of the humerus? And also can be asked the name the muscle supplied by the axillary nerve. These questions can be asked based on this case. So let's see the answers or the solution of these questions. Let's see a common causes of axillary nerve injury. As we have seen in this case, the patient was a chronic user of the crutch. So due to the continuous pressuring upward into the armpit, the axillary nerve can be damaged as we have seen in this case. A second is the inferior dislocation of the shoulder joint. As you know, mostly the shoulder joint dislocated inferiorly where there is a axillary nerve is present. At the neck of the humerus also the axillary nerve is present. So when there is a inferior dislocation of the shoulder joint and fracture of the neck of the humerus, there are chances to damage axillary nerve. The fourth one is a intramuscular injection. Due to the improper practice, the cutaneous supply can be damaged due to the intramuscular injection. Origin of the axillary nerve is from the posterior cord of the brachial plexus and its root value is a C5 and the C6. So this is the origin. You can see in this picture also, this is the posterior cord and this you can see the course of the axillary nerve. When there is a damage to the lateral cutaneous nerve of the arm, which is again the branch of the axillary nerve, in case of the intramuscular also, it can cause the damage to the lateral cutaneous nerve of the arm. So again, due to the using of the chronic crutch, as we have seen in this case, there is a compression of the upper lateral cutaneous nerve of arm, which is a branch of the axillary nerve, and it can cause a loss of sensation over the lower half of the deltoid. This is also called as a regimental anesthesia. The patient also lost a shoulder counter due to the paralysis of the deltoid muscle. The muscle atrophies and loses the shoulder or the rounded counter, and the shoulder region become flattened. And this deformity, you can compare, this is the right one and this is the left one, you can compare, this is the shoulder counter, which is, I can say, the normal side, and this is the injury or the deltoid atrophy. You can see clearly over there. Due to this atrophy of the deltoid, there is a prominence of the greater tubercle of the humerus, and this deformity is also called as a flat shoulder. So, cause of loss of shoulder counter is due to the paralysis of the deltoid muscle. Muscles supplied by the axillary nerve are the deltoid and the teres minor. You can see here, this is the posterior cord and this is the axillary nerve course, and this is the muscular branch. You know, this is the region of the deltoid muscle. So mainly deltoid, and this is the again the branch which goes to the teres minor muscle. So these are the two motor supply or the motor branches from the axillary nerve. When this branches is affected, the patient could not abduct his arm up to the 90-degree. And this condition, that patient is unable to abduct his arm, then the loss of sensation, this condition is also called as an axillary nerve palsy.